what I want to just come on to is some areas where we're seeing in our marketplace, and I'm sure you are as well, and some of you are actually in the room, around that combination of innovation within the space and also investment. And ultimately, please forgive the analogy, but I've heard years ago, I don't know whether you remember the sort of the Tate and Lyle logo, and it is quite hard to depict, but basically it's a dead carcass, and I forgive the analogy, but it's got bees going around it, and the saying there is sort of out of the strong came forth sweetness, and it's that sort of analogy that actually the system is really under pressure, but it's strong, and I think ultimately there are signs, and we know you folks are growing in these sorts of spaces. Now, to give you a bit of flavour, on the demand side, I think there are various businesses we've seen in around pathway management. So CHS, for example, does hospital discharge services, health share in terms of patient management through a patient pathway, so helping kind of smooth up and kind of manage that sort of process. You've got certain outsourced contracts out there that there's an alignment of interest between the commissioner and the provider. And what I mean by that is ultimately there's a provider that's incentivized to try and manage demand on that side of things. And then also you've got private pay. Now within private pay, you have ways in which to pull demand away from the system before it hits the public purse. So fertility, private dom care, for example, as well. And these are tried and tested, but there's a range of investment that has been going into these places, and we expect it to continue. On this interplay between demand and supply, there is also another crossover, and ultimately you've got the outsourced provision and independent provision. So Spa Medica is an ophthalmology business, and Optegra is another one. They've been growing like absolute topsy, doing things like cataracts and situations like that, which is effectively picking up work that was on the NHS. They're still being funded by the NHS, but effectively taking that demand away. There's quite a lot of mechanisation in that. And that's been an active space for investors. Insourcing is a space that we've been active in over quite a few period of years, and that is effectively helping the NHS deal with waiting lists. And I know obviously you've got some data from HBS on that side. Going back to my earlier comment and point around the waiting list, that is really challenging. Trying to find ways in which to tackle that is in everybody's interest. And you've also got social care operators that can help local authorities deal with those sorts of challenges. And then ultimately, you've got the final point you can't quite see from the graphics, but you've got providers that are adding capacity. So there's Exemplar, which is a specialist neurological care provider that's been adding capacity in the social care space. And bits like Vanguard, which is, I don't know whether you know it, but it is mobile operating theatres and the like, giving the NHS that extra capacity it needs in these sorts of times.